Hey everyone, welcome back to the Autism Uprooted podcast with BioNexus Health. Today we are going over to the United Kingdom, speaking with Isabel. Isabel is a massage therapist, and she has a son, Zach, on the spectrum, and he's had just a spectacular turnaround, especially with his gut. But we'll let Isabel, tell us all about that, shall we? So let's go ahead and welcome Isabel to today's podcast.
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hey everyone. So we have with us today Isabel, and Isabel is from the UK. And, we were just discussing Zach's amazing progress, So, Isabel, Zach is, sorry, I'm recovering from the flu and my voice seems to be a bit off. One sec. So, welcome, Isabel. Thank you for the recording today.
No problem.
I really appreciate it. It's so important to get the word out, and especially when Zach is doing so well. He's come such a long way. If you don't mind, would you be able to summarize Zach's journey on the spectrum with the BioNexus herbal protocol? We've seen tremendous improvements along the way, right? With his gut, with other medical conditions he's had. So a couple minutes, if you wouldn't mind summarizing overall.
Yes, that's absolutely fine. So we started the protocol around 2 years ago, and it's been a very slow progress with Zach, really. Because he did have a lot of gut issues and digestive problems. And it was really allergies, I think, a lot of allergies to dairy and gluten and all that kind of thing. So it was really sorting out the diet, making sure he had, the right diet, lots of fruit and vegetables, and just the consistency of the herbals, making sure I was doing it every day, making sure I was consistent, making sure I was getting, the probiotics. That was brilliant for Zach. That sorted him out. Every time I was making it, I was like, oh my goodness. But, I was just like, come on, Zach, teaspoon of honey, because obviously I just pretended it was honey. And he was like, he would take it. But I'm convinced mended his gut completely, because he had a prolapse. He actually had a prolapse, and I was being called into school to help him in the bathroom. It was a really difficult time, and I can honestly say within 2 weeks his gut was so much better. So that was kind of the start, and just general progress has just been week by week getting stronger. His body has been mending, and his overall strength, he started swimming. He can swim lengths now, whereas before he was scared to even kind of get in. He's just overall much stronger, much happier. His mood as well. He's just more friendly, more social.
Okay. And okay. I'm sorry. Yeah. So can you just, how old is Zach now?
9.
Now he's 9 years old. So yeah. we started with him when he was 7. And when we started with him, he was nonverbal. You have always tried to keep things very natural for him. Mm-hmm. Right. So was he going to school when we first started? Were you seeing any kind of progress in school?
Yes. So school basically have been coming back saying that he's much more exploring the classroom a lot more.
Oh, this is now.
I would say he started about 6 months ago.
6 months back. Okay.
Yeah, properly wanting to explore the classroom, and he has a talk tablet which he uses, And he's been requesting to go into other classrooms and see his friends. And so he's curious. And he's actually starting to speak since I've been doing the camel milk as well.
Oh, that's wonderful. Yes, Isabel, that was one thing, because everyone asked me, can we start camel milk? Because there's a lot of mixed information out there, and it's important to understand for those listening that, there is no magic pill, as all of us autism mothers know, that it requires a lot of hard work and doing things in the right order.
Absolutely. I couldn't go in with everything. I couldn't go in with, because years ago when he was little, I just gave him a probiotic one day. It was just an off-the-shelf Biocult probiotic, and he had a massive reaction. He literally had a massive tantrum, meltdown, throwing things around the room. And I was like, wow, this is really affecting him. Right. This is not a good thing. You have to do it all in step by step. The gut has to be ready, and exactly. With your advice, doing everything in order, the herbals, and now introducing the camel milk. It's his speech is coming. It's actually coming, and I honestly, living in hope, but we never knew if he would. That's absolutely the best thing ever.
That's really fantastic, especially with his gut, you having to go to school to help him in the bathroom every day because of his rectal prolapse, right? You actually, you actually literally had to put the prolapsed rectum back in.
Prolapse back in because he was so constipated. His poor little gut, he was so constipated that he couldn't actually go. So all his insides were inflamed, and of course the staff are not licensed to do that. So I had to go in. And then of course it was, my pediatrician was recommending a doctor down in Southampton to take him to. And I was just like, I really don't want to do that. I really don't want any surgery or anything going on for him. I was really worried. And as if by magic, but absolutely brilliant. Yeah, it worked for him. Yeah,
it worked for him. God bless. Yes. Wonderful. And so
wonderful. Give him the probiotic every day that you recommend.
Yes.
And with the probiotic and the herbals and the camel milk, it's working. It's just working.
Well, and see that I love to hear stories like that, which is why I wanted you to share that, as a mom, avoiding surgery, keeping things very natural. I mean, obviously, if it is something life-threatening, modern medicine is amazing. You have to do what you need to do. But sorry, but if there are alternative natural ways to heal, and you see that your child is responding, many parents often are able to avoid things like surgery. They're able to avoid, invasive treatments like colonoscopies and endoscopies, because the gut gets better, the child gets better, and you can't argue with results. It's just so we have a Zach who has he's calmed down a lot, right? Did he have any kind of hyperactivity to begin with? Did he have any sleep issues?
Sleep issues, yes. Sleep issues. He is getting better. It does take him quite a long time to drop off to sleep, but once he's asleep, he does have a deep sleep. He is quite attached to me. Sometimes he does want to come and find me in the night, but it's just because he wants me, but generally his sleep is really, really good, like 8 hours, 9 hours a night. But his mood is so much better in the morning, when he gets up. Before he was quite moody and didn't really want to get up and hide under the covers, but now he's much easier. And he checks to see his uniform, what clothes am I wearing today? And I've got the uniform pile, and he goes to have a look, and he's fine with it. It's like the school. Oh, it's my school uniform. Oh, it's okay. I can deal with it, and he's actually happy to go to school. He's happy to go to school. which is all we want, you know. And the other day when he came out and said, I was at work, and he came out of school and said to my friend, "Merry Christmas," to my friend. And she didn't know that he'd started talking. And she
Wow.
heard me crying. She said, "I'm so emotional." Zach said, "Merry Christmas." So brilliant. Absolutely. Gosh, amazing. Yeah.
That is, it really warmed my heart to, and it's so in, it's in with the spirit of the season, Isabel, isn't it? So you have little Zach, he's happy, he's going to school, he's paying attention, there's focus. You're actually getting good reviews from his teachers. You don't have to go to school every single day as well. He's more independent. He's got awareness, socialization. He wants to play. He's curious. He wants to learn. It's just been a pretty amazing transformation for him.
It's amazing transformation. And I just feel he's just going from strength to strength. I mean, we've had to do a lot of input with the speech. He has a lot of input, but it's coming. It just seems like over the time with the supplements and the fish oils and everything else, it's all clicking into place finally. And we still have a long way to go with the speech, but bit by bit, I see it's there. It's coming. So it's just thank you. It's huge. I cannot thank you enough.
Oh, it's been an absolute honor to help Zach. Many parents ask me that, oh, I have a child who is already 7, 8, 9 years old, and will it work? I'm absolutely. It is so scientific. It's like a beautiful marriage of science and nature. You use science to investigate, get some labs done, like we did with Zach, to see what exactly is going on, right? Nutritional, gut issues, all of those can be helped and supported and repaired and regenerated with herbals, supplements, all plant-based, which is what we did for Zach. And I have another patient that I'll be doing a video with is the mom actually had fatty liver disease. And poor mom, I mean, autism moms just give and just, kind of neglect themselves in that equation. But now, Wendy, she is, so you guys remember to watch Wendy's podcast too, because her fatty liver disease, right? It's supposed to be, it is what it is. It's incurable, just like autism, but it's gone on scans because, she said, her child is doing well. So she wanted to, now she had time for herself. So she was able to join the BioNexus protocol, and we of course customized it like we do for all patients. So that's what we did for Zach. He had his own customized protocol. We looked at all the numerous medical issues which he had in his labs. We got his lab results. And then, Isabel, the first thing I remember you telling me is that Zach is happy now. He's not distracted. He's able to sit down, focus. He's more independent. And the other thing that really touched my heart, Isabel, was when you said you've been able to go back to work, go back to the work you love to do, right? Couple of days.
Yes. So I'm a therapist. I work in a spa.
Okay.
And so I have been able to go back to work and have my childminder collecting from school. And I've been able to really relax and enjoy my work and not be so worried about him. And that is such a huge thing for a mum, to be able to just have that little window, of time when it's my adult time. I talk to other people, normal things. And it's really important because my life is so consumed with Zach and his protocol and getting it right and keeping him on the right path, that to be able to take 3 days a week for me is fabulous. Yeah,
absolutely. I love it. It's you getting to be your own self, right?
That's
Separate
right
from,
I mean, I've got 2 girls well. So there's 3 children here, and they all have their needs. They all have their needs, and they need me, and they need me to be with it. They need me to be, 100%, mom and good mom and everything. And so by being able to go to work as well, it's just a really good balance.
Yes.
Yeah.
One other thing I remember in the past you mentioned is that, Zach going to school in the beginning used to be more like babysitting. They were just watching him and then he would come home. There wasn't any real learning occurring. And now, right? Yeah.
Now he's getting Star of the Week, little Star of the Week certificate.
Star of the Week? Oh my gosh, wow.
Yeah.
I love it.
Yeah. And we're actually, because he's in a school at the moment for all the children are on the spectrum. It's a school for all children with autism. But Zach doesn't really have any behaviors. Zach is very calm, very calm. And so we're looking at a different school now, which is a speech and language school. So not all the children there have autism. It's a kind of a half and half school. And so we're really hopeful that he'll be going to that school in about a year's time for his secondary school.
For his secondary school, okay.
So that they will be working more on the speech and, English and, it will be sort of the next level, and he'll be away from the children which do show the very more aggressive behavior, which for Zach, he's quite sensitive. So if he's in a noisy classroom, it distracts him. So through him healing, we're able to move him on, if you see how I mean. Yeah, so it's
a new school. Yes, Isabel, that brings me to 2 things. I'll be speaking about sensitivity with Zach, but did you hear about the new BioNexus herbal blend, the speech blend?
No, mentioned that you were working on one. So
I am, yes. It's in the works, and give it about a month or so to come back from third-party lab testing, right? I mean, everything has to be done according to FDA standards. So everything is done according to FDA standards. So we have double FDA, not FDA. We have double third-party lab testing. One, it goes to Cornell Agricultural lab for testing, and then it also goes to another third-party lab for testing, just to keep it nice and tight for anything. For when I say third-party lab testing, it is for impurities, for and any kind of unwanted stuff in there, heavy metals, mycotoxins, etc. So all of that. Yeah, all of our herbals are absolutely certified and tested for all of that, and it has to be clean and clear. So give it about a month or so for that to happen, and I'll announce it for sure. We'll send out one of the BioNexus newsletters, and I've got the attention and focus blend, and I've got the SPH support blend, the speech support blend. And another one that's going to be important for many as well for Zach, Isabel, is the vagus nerve support blend. Because, right, so Zach has gained his calm and focus and concentration and learning curiosity. He's gained that so far. But doing vagus nerve stimulation, what is available out there right now is very device based. You have to consider EMFs. It's on the phone, it's on the ears, and oftentimes children on the spectrum don't like that, having anything stuck in their ears, or they are EMF sensitive. So I decided that I need something for my son as well, and I decided to go ahead and research into vagus nerve support, both support and stimulation, which is what is required. So that's another blend which will be coming out right after the attention and focus and the speech support.
Sounds absolutely wonderful.
So keep that in mind. So I will keep you informed.
We can add that one in. Yes.
Yeah, we will. Yes. And for those, for those watching, remember, Isabel has mentioned about sensitivity with Zach and about, going slow and steady, which is something that has to be respected in a child. Patience from mom and dad is very important. It took us about a year almost to slowly build up the protocol because of mast cell issues, which are often disguised as allergies, but in reality, it is mast cell activation syndrome and multiple chemical sensitivities, right, with children on the spectrum that have biotoxin illness. So you have to go low and slow and build up and allow the child's sensitive body to get used to it. So oodles of patience is required. And when Isabel mentioned camel milk, she's talking about a small amount. Go ahead, Isabel. How much camel milk are you doing? Like, half a gallon a day?
No, I couldn't afford that. So it's a teaspoon. It's like, it's almost, yes. I'm heaped. I'm sort of getting towards a heaped teaspoon now.
Yes, yeah, that's good. One teaspoon.
His coconut yogurt he has a banana with the yogurt, and I mix that in with his other supplements as well. A little bit of honey, and he loves it. He absolutely loves it. And since I've been doing that, the speech is starting to come. It really is. I'm convinced it's the camel milk. Well, I'm convinced it's, of course, it's everything, but
kind of come together,
especially with the camel milk and the probiotics. Definitely, it's all about the gut and the gut brain thing.
Yeah, exactly. Yeah. Yes. Gut brain and brain gut.
Sure.
Because some of the infections like MARCoNs, right, from when you have MARCoN from biotoxin illness, those toxins cross over the blood-brain barrier. So you have the gut-brain issues with that. So it works both ways, right? It's not a one-way street. Yeah. So that is the important thing. All right, good. And you said that with Zach recently had cold and strep and flu and whatnot. I mean, it's
really high temperature and shivers. For 2 days. He had it 2 weeks ago for 2 days. But we just monitored him, kept him warm, kept him home, and his body fixed it. His own body actually fixed it. Like you say, he's when they have a temperature, it's the body's way of showing you that they're healing. You don't need to go and get the Calpol and the paracetamol. You don't need that. You just need to look after them. I did use belladonna, some homeopathic remedy, which really helped. Mm-hmm. Giving him lots of liquids, but he's got over it, thank goodness. Yeah.
Yes. No, that is a beautiful way of dealing with fever. Many children on the spectrum, many parents without fail will tell me, oh, we haven't seen a fever in years. We don't even remember when was the last time there was a really good fever. And a good fever is a great sign from that your immune system has identified what the issue is, and it is starting, right? Your body is giving you a fever to kill off the viruses, to just start to self-regulate, and that is so important.
Because we all panic,
right?
We panic a little bit as parents when we see a fever. We're like, oh my gosh, what's happening? But it's okay. It's okay. Body fixed it.
The body fixed it. He's doing a little better now. Yes, I agree. Obviously, if there are children who have had a strong history of seizures or do have seizures, you have to monitor the fever. But other than that, allowing the fever to break on its own, obviously staying hydrated, electrolytes, minerals, right? Cold compress, good food, all of that is important, and close monitoring. So, but otherwise, it's let the body do its thing.
Exactly. And I think since COVID as well, there's a lot more bugs around. And of course, now the masks are off and it's very, very cold here. We've had snow. So I think the classrooms have got the windows shut. So I just think, they're just, all the bugs are coming out a bit more.
Yes.
It's just this process we have to go through, I think.
Yes, like you also mentioned, and unfortunately you're right about that in a special needs classroom, the bugs will spread because not all parents are aware that not having a fever doesn't mean that you're not sick.
Right. Yeah.
So you have children, in the same classroom, because they are special needs, they're not getting fevers, they're still coming to school in spite of being infectious, because somehow, fever is the standard of infection. Someone has a fever, you stay home, it means you're infectious. But what if the poor kid has PANDAS and not getting a fever? Because with PANDAS, you get the alternative fever response. So yes, yes, sorry.
It's complicated.
It's complicated, yes. So just like Zach, many children in my practice are getting repeated infections. My own son got it like twice, because other people are coming back to school too early.
Yeah.
That's
I keep telling all the parents on the message on the parent chat group, please keep your children off if they have a sign of a cough or anything, because it's not fair on the kids that are well,
Right.
Yeah.
Right. It just debilitates them more, and one thing I want to take a chance to, take advantage of mentioning here is the rash around the mouth or anywhere else in the body when a child has strep, right? It's, you'll often see a little rash with little pustules, little bumps, and it is impetigo. Usually when there is strep, it could be some other kind of eczema, or if it is a virus like the flu virus, you might see some older viruses getting reactivated, cold sores and what have you. And for those who are BioNexus, those watching who belong to the BioNexus family, get yourself the SS blend, the strep support blend. The SS blend, you can just take a few drops and just apply on the rash, and it works really well.
That's brilliant, because Zach has had the little bumps around his,
Mm-hmm.
Around his nose, around his top lip, and they come up and down. Sometimes they're there, and I'm like, oh gosh, what's that? But it must be to do with the strep.
Correct.
I think. Yeah.
Yes, strep or any kind of a reactivation as well. So just take the SS blend and dab it on the rash. We have a visitor.
Hi.
Hi, Zach.
Zach, look, say hi. Oh, say
How
hi.
you doing? How are you?
Got a thumbs up? Yeah, good boy. You're gonna go next door and watch your thing? Yeah, good boy. Yeah.
Good listening, Zach.
Yeah, you feeling better today? Feeling better? Why? Yeah, good boy. You're gonna say bye-bye. Bye-bye. Good boy.
Bye.
Later. Are you gonna go or are you gonna stay? You're gonna go find your sister. Go find Chloe. Go find Chloe. Yeah, I'll see you in a bit. Bye.
Aww.
Or you're gonna stay, he's just gonna stay there, that's fine.
All right, that's fine. He's really grown. He's grown really well,
He's really great. He's doing so well. He's like a beanpole now.
Yes, so no constipation, gut is fine, and he's absorbing his nutrients now, and he's growing. That is so important. Wonderful.
It's great.
Wonderful.
It's all amazing. Thanks to you.
Absolutely a pleasure, always. So listen, thank you for doing this.
No problem. I'm happy to.
Thank you. It's going to help so many, Isabel. So many moms and in autism families watch.
Yeah, that's brilliant. That's brilliant. Thank you very much for having me. Put your leg down. Come here. Now, give me a cuddle. A hug. Yeah. Come here.
Oh my gosh.
You're a good boy. You're a good boy.
Yes, you are. Yes,
are you happy? Lucky. Look at mummy. Are you happy? Happy. Yeah. Are you going somewhere? Are you going off now? Come on then. I'll see you later. Say bye-bye. Zachy, come here. Bye-bye. Bye. Thank you. Bye.
Bye. Bye, honey. Ah, there he is. He's going to make himself comfortable.
Yeah, he's just going to take a little seat there. His favorite place.
So you, Isabel, you mentioned that he is reading, writing, holding, holding a pencil.
Yes.
He's starting to do sentences.
Yes, he's starting to, construct sentences with words at school. He's starting to hold the pen and write as well. And his concentration is better. His concentration is better. So that's going really well. And getting Star of the Week, like often coming home with Star of the Week, which is just lovely. It's lovely. And he's more social and just generally more happy, as well. So, I mean, that's all we could want.
Yes,
yeah.
Of course. He's happy to go to school. He's happy at home, and today he's actually just getting over the strep and the flu, and he's in remarkable good spirits.
Yeah. I mean, you saw him. He's very chill. As you hear his cough there.
Yeah.
He's very out. He loves being home. He's just very calm and happy. He's happy doing his own thing. He's not very demanding, which is nice.
Yes.
Of course, lovely. He's a good boy.
Yes, having the hyperactivity calm, the child calm and happy and focused and relaxed is a huge relief, not for the whole family, yes, but for the child's own body. So you learn to self-regulate, and all these other things will come. It just takes time, especially when you reach the level of sensitivity that Zach already had with the mast cell issues when I first met him. So, he's going from strength to strength, isn't he?
He definitely is. And he's much more compliant when you go out and about. Like, he'll just hold your hand and go shopping. And he'll actually help, like, around the supermarket now, pick things up. If you say, go find the bananas, he'll do it, put them in the trolley. And then we come to pay, he puts all the things on the conveyor belt. He follows instruction. And he's a good boy. Whereas before I started the protocol, I'd be worried that he might just like run off, or like, just like run out the shop.
Right.
Now it's like you can actually enjoy going shopping. So that's amazing as well. Yeah. All thanks to you.
Absolutely. And I just love your smiles and giggles and it's like Isabel is Isabel again.
Yeah, because he's healing and I'm not so worried.
All right. Well, that brings us to the end of this podcast with Isabel, and I'm sure it was quite inspirational for those watching. Never lose hope. Always keep smiling. Take good care of yourself and your family. And thank you for joining me today. I will see you guys again back here with the BioNexus Health podcast, Autism Uprooted, on the next episode. Until then, take care and namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.